Thank you very much. Okay, welcome to our afternoon session today on New to Medicare, sponsored by the Colorado Gerontological Society. So we're going to start out this afternoon. If you are turning 65 within the year, basically the intent of this session is to learn more about when to enroll in Medicare Part A and Part B, depending on your personal situation. There's a lot to kind of learn about Medicare, what the different parts are, what the penalties are, what the deadlines are, and they vary depending on your own personal situation. So we're going to start out by looking a little bit at the basics of Medicare. So probably the most important thing for you to know is that Medicare has parts A, B, C, and D, and insurance companies that support or provide additional coverage are known as plans. And we have three types of those: Medicare Advantage, which supports Part C, and then prescription drug standalone plans, which support Part D, and then Medicare supplement plans, which support Part A and B. So just a quick overview, we see that original Medicare includes Part A, hospital insurance, as well as Part B, medical insurance. So Part A of hospital insurance covers hospital stays, skilled nursing rehab stays, hospice care, some home care. Doctor's visits and other services provided either in a skilled service or a skilled rehab or in a hospital are billed to Part B. Part B then is medical insurance, which covers doctors, specialists, nurse practitioners, PAs, outpatient care such as emergency rooms, labs, x-rays, ambulances, outpatient care such as like MRIs. Covers medical supplies like oxygen, diabetic supplies, wheelchairs, and then preventive services like annual wellness exams, welcome to Medicare, physical, and things like vaccines, as well as mammograms and other things like that. And then Part C can be looked at as covering Part A and B, as well as sometimes D, most of the time D. So you get everything you got in original Medicare, and usually there's some additional benefits like dental, vision, over-the-counter items. And then Part D is prescription drugs. So Part A, the deductible, which is the hospital deductible, is going to be $1,632 per 60-day period for days 1 through 60. If you're in the hospital more than, or you have to go back to the hospital on day 61, you would have to pay the $1,632 again. That can be covered by a Medicare supplement, which we'll learn more about in a little bit. The monthly premium is free for most people. However, if you have worked 30 to 45 quarters, you are 39 quarters, you pay $278, and for less than 30, you pay $505 a month. If you're in the hospital more than 60 days, the copay is $408. If you're in the hospital more than 90 days, it's $815. In the skilled nursing, the charge is free for days 1 through 20, and then days 21 through 100 is $204. And then after day 100, there is no coverage. You're on your own. Part B, the deductible for 2024 is $240, and that has to be paid before other services will be charged to Medicare. And then there's a monthly premium of Medicare that you have to pay every month. For 2024, that will be $174.90. And then you pay 20% of outpatient services, and Medicare pays 80%. On the Part C, basically, the deductible varies by the plan. There are 68 plans or more that are offered by 11 companies in Colorado. Most companies have a zero premium plan. The co-pays for like hospital care vary, but what I'm seeing as I reviewed those is around $325 a day for the first like 5 days. You have then usually a flat copay for Part A services, and usually a $204 day charge for like days 21 through 100 in skilled nursing. And then the plans have some outpatient copays for a variety of things. Most Part B services, after the Medicare Advantage covers, you pay the 20% copay. So if you need oxygen and it's $100 a month, then you would have to pay $20. If you had an MRI and it was $10,000, you would have to pay $2,000. There is no insurance coverage for the copays and the coinsurance and the deductibles under Part C. Part D, the deductibles also vary by plan, but the standard this year is $545. The monthly premium varies by the plan. There's 21 plans offered by 8 different companies. There is one company offering a zero premium that is called WellScript. The copays vary. There's usually 4, 5, 6 tiers. Tiers 1 and 2, from what I can tell, are relatively reasonable, but when you get to tiers 3 and 4, and sometimes by the time you get to 5 and 6, you're paying a percentage. Tiers 3 and 4 seem to be that you're paying 25, 30, 35% of the cost of the drug. When you get to tier 5 and 6, you're usually paying approximately 50%. So with that as kind of background, let's look a little bit at eligibility. So you are eligible for Part A and B if you are 65 and over, or if you receive Social Security disability for 24 months and you have paid into Social Security, or you have a spouse who has paid into Social Security and you have been married for 10 years or more. Part C, you have to be enrolled in Parts A and B, and you have to live in the zip code of the plan that you are wanting. So, for example, Kaiser is not does not offer services in Burlington. So the zip code, I don't remember, for Burlington is 80208 or something like that. So you have to live in their zip code. Part D is a statewide benefit. You have to be enrolled in Parts A and B. And regardless of whatever state, county or zip code you live in Colorado, you will be covered. A Medigap, which supports Part A and B, you have to again be enrolled in Parts A and B, and coverage is guaranteed if you enroll during your initial enrollment period. You can enroll after the initial enrollment period, but you may be subject to underwriting or pre-existing conditions. So probably for today's presentation, this next section is the most important, which are the enrollment periods. When do you actually enroll? So on the initial enrollment, you basically can sign up 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. So there are 5 different types of enrollment periods. So there's the initial enrollment period, which most of us are familiar with. The second type of enrollment period is the annual enrollment period, which runs from October 15th to December 7th every year. And you only care about the annual enrollment period if you are looking to enroll in a Medicare Advantage plan, or you want to change Medicare Advantage plans, and you care about it because that is when you need to review your prescription drug coverage or your Part D plan. Your open enrollment then, if you miss your initial enrollment period or you miss the annual enrollment period, you can enroll during January 1 to March 31. You basically can either change or drop an existing Medicare Advantage plan under the open enrollment. The second thing that happens from January 1 to March 31 is what we call the general enrollment period. And if you didn't sign up for Part A or B when you were supposed to, when you turned 65 under your initial enrollment period, then you can enroll in the general enrollment period. And then coverage starts the month after you sign up. This used to be that coverage started July 1, but they changed that about a year ago. And then the other type of enrollment period is a special enrollment period. Usually that lasts for up to 18 months. There is more than one type of special enrollment. The most common one that we see is that somebody was enrolled in an employer health insurance coverage. They have left their employment and now they are looking to enroll in Parts A and B, or a Medigap with a Part D or a Medicare Advantage plan. So this is kind of a quick summary, if you will, of the different types of enrollment plans. So basically you can look down the left-hand column and you can say, is this me? So if you're just turning 65, you're in the initial enrollment period. If you had employer coverage, then you're in the special enrollment period. So it tells you then in terms of what is this for, it tells you which type of plan that you can enroll in based on the type of enrollment period that you are most concerned about. And then when can you enroll? Again, that is a duplicate of the previous slide. And when does coverage start? Basically, when you in your initial enrollment period, it starts the first day of the month you turn 65. So if you turn 65 on October the 20th and you sign up for Medicare, your benefit will actually start October 1. So this just gives you a summary, if you will, of when your coverage starts. Other types of special enrollment periods depend on different things. So you can get a special enrollment period if you are eligible for Medicaid or a Medicare savings program. If you participate in a state pharmaceutical assistance program, say the Ryan White Fund or something like that. If you are chronically ill or have a disability and receive Social Security benefits. So if you are on SSDI and you turn 65, then you would get a new special enrollment period. Or if you were diagnosed with Lou Gehrig's disease, you could also get a special enrollment period. If you're enrolled in a special needs plan, and this is sometimes called an SNP or a SNP, and there are 3 different types of SNPs. There's a D-SNP, which is in the community or for dual eligibles. There's a C-SNP, which is for people with certain kinds of chronic diseases. And then there's an I-SNP for people who are in institutions such as a nursing home. You qualify for SEP circumstantially as well. So you might get an SEP if you move to a new service area, if your Medicare Advantage plan leaves the area, if you lose or get a new job, which is what we just talked about, if you go into or out of a skilled nursing facility, or if you either gain or lose Medicaid eligibility, or you leave prison. One of the things that becomes really important if you are looking at special enrollment periods is something called credible coverage. And what that basically means is that you have benefits that are as good as or better than Medicare. And we care about credible coverage because it exempts you from any type of penalty, either intentionally or unintentionally, for Part A, B, or C. It gives you the special enrollment period, and it allows you to enroll in B anytime while you remain covered under your employer plan. So that's really important, is to know that. If you have any questions about whether or not your coverage is credible, check with your HR department and have them check with Medicare. Credible coverage. So if you are in TRICARE or you work for the federal government and you have FEBA, you're always going to have credible coverage. If you have employer health coverage or some kind of retirement health coverage, it may or may not be credible. And if you enroll in COBRA, or if you get your care from the Veterans Administration, that is never going to be credible coverage. So sometimes people are encouraged to sign up for COBRA when they leave the workplace. If you leave your workplace and are 65 and over, do not sign up for COBRA, but rather sign up directly for Medicare. Now, you always want to protect your special enrollment period and avoid any of those penalties through your by changing coverage from your employer. So if you don't have Part B and you get your Medicare card showing that you are enrolled in Part B, simply return it. Let them know that you have credible coverage and that you are refusing B at this time. And then when you lose your health insurance coverage, whether voluntarily because you chose to retire or involuntarily because you have been let go from your job, then you need to file this CMS-L564 form. You fill out a part of it, your employer fills out a part of it, and that gets filed with Social Security. And that then allows Social Security to process your application through the special enrollment period. If for some reason you lose your special enrollment period, you can always apply through the general enrollment period, January 1 through March 31, and then get coverage. If you don't have credible coverage or you fail to enroll, Part A still has no premium and you can enroll at any time. Your coverage can be retroactive for up to 6 months prior to your enrollment, but no sooner than that. And you can enroll without a penalty. Part A with a premium, basically you'll have to wait until the general enrollment period, and the penalty is 10% of your Part A premium. That's usually where people end up if they didn't get enrolled properly. And then if you get assessed a Part A penalty, it's 10% for twice as long as you were eligible and did not enroll. So if you were eligible for Part A for 24 months, you didn't take the free premium or the free option, you would then have to pay the 10% penalty for 48 months. Under Part B, you usually have to wait till the general enrollment period, which is the January 1 through March 31. You get a 10% penalty for each 12-month period that you were eligible and did not enroll. And that 10% is each month. So 10% of the Part B premium. So this year it's $174. Your monthly premium would be $17 per month. Your enrollment in Medicaid, then, how do you do that? Medicare, how do you do this? You basically go to Social Security, and you can do it by phone, you can do it online, or you can do it in person. You need to take your birth certificate. If you're here on a green card, take any of your green card documents, or if you have any immigration forms, you take those. So this is a flow chart that basically walks you through the process of enrolling. So you confirm your eligibility, and then you look to check and see whether or not Medicare is right for you to enroll in. You probably want to check with your physicians to see if they accept Medicare. If you're low income, you may also want to check to see if you're eligible for the Medicare Savings Program, which will help with the Part B premiums, and maybe if you're really low income, some additional co-pays and deductibles, and Part D if you're eligible for extra help. If you want to purchase a Medicare supplement and a standalone Part D plan or a Medicare Advantage plan. Get yourself a Social Security, My Social Security account, and then you can either apply online, you can call the 800 number, or you can go to the local Social Security office. So documents that you may need to enroll in Medicare. Almost everyone needs a birth certificate, although sometimes they are now able to do with data matching and they already have information on file. So especially with the online systems, you may or may not have to mail that in. Obviously, if you were born outside of the United States or you have a resident card, you will need to provide those. If you have any kind of group health insurance, if you have coverage that will continue past age 65, then you'll need to provide that information. If not, you're terminating your group health insurance, then you don't need to provide any information. People who were in the military will be asked about the tour of duty, the branch, and when they were started service, as well as they were discharged on their DD 214. And then if you were, like I said, employed past age 65, then you'll need to provide credible coverage. If you're self-employed, you may also have to provide additional information just to make sure if your Social Security taxes are being credited, what your business name is, and you may have to provide your previous year tax returns that will help to determine your Part B and D premiums. Pretty much it's mandatory that you have your Social Security check deposited into a bank account. So they're going to ask you for the account type, whether it's checking or savings, and the number as well as the routing number. If you don't have a bank account, you can use a Direct Express card, but I don't advise it. People end up with a lot of problems, if you will, if they lose their card or if they have some other issues. So my suggestion is to always open up a bank account, even if that's all you use it for, is to deposit your Social Security check. And I don't care if you go to the bank every month and draw 100% of it out in cash, doesn't matter. So when do you enroll in Part A and or B and D? So if you're age 65 and you're already receiving Social Security, so let's say you were 62 or 64, you signed up for Social Security. At that age, you will get your Medicare enrollment will just happen. You'll get card in the mail one day about a month or 6 weeks before you turn 65. If you enroll in Part A and B and you're turning 65 and you're still working and you don't have employer health insurance, then you'll want to enroll in A and B both. If you're turning 65 and you're working and you have health insurance, then enroll in Part A and delay Part B and D. Now, it is possible, depending on the size of the company that you are working for, that your company might require that you enroll in Part B and D, especially if it's a company less than 20 employees, because what happens is that the company insurance pays first if you have a need for care, and then Medicare pays second. So if you are in that situation, the company may require you to enroll in A, B, and D, or in a Medicare Advantage. You always want to enroll in Part B then when you quit working. Do this within 8 months, and there's that CMS L564 form that you will sign and your employer will sign. Open up your My Medicare account. This will help you to track where you are in terms of getting your Medicare coverage, what services you have, etc. And then after you get A and B, you get your card, then you'll need to enroll in either a supplement with a standalone D plan, or you can enroll in a Part C Medicare Advantage plan. Probably most of you have seen a Medicare card, has your name. Your Medicare number used to be your Social Security number. Now it's a scrambled bunch of numbers and letters. And then Hospital Part A will tell you what day that coverage started, and B will tell you what day that coverage started. For some people, if you delay enrolling in B, the dates will be different. So just to go through then the penalties for late enrollment. So Part A is 10% of your monthly premium for 2 times the years that you did not enroll. So always, always, always take A at age 65. Part B then is 10% of your monthly premium for each year that you didn't enroll. And then Part D is 1% of the national average premium for every month you did not enroll. So this year, the national average is around $71. So you would pay your monthly premium plus about $7 for every month you did not enroll. Though the path then for supplemental coverage is either to do a Medicare supplement with a standalone prescription drug plan, or a Medicare Advantage plan with an integrated prescription drug plan. And that's basically what is in this chart. Is on the left-hand side with path 1 is the Medicare supplement plus the Part D, or you choose a Medicare Advantage, HMO, or a Part PPO, private fee-for-service, and then that usually has a Part D benefit included. And then you don't have to enroll in the standalone plan. You cannot enroll in a Medicare Advantage plan at the same time that you are enrolled in a Medicare supplement. That is illegal. So you have one or the other. So considerations when you are choosing coverage, obviously one is, what is the cost? And there is huge variation. In Medicare supplements, there's a monthly premium that can be quite costly, but most of the time, except for the Part B deductible, there's no out-of-pocket expense. A second thing is what kind of insurance you have, what kind of insurance you like, what kind of setting that you want to be in. Do you want to be in a clinic setting like a Kaiser? Do you want to be in a United or one of those groups where you have a network of providers? or do you want to have the freedom to go to any provider in the United States that accepts original Medicare, and go that route? Then you want a Medicare supplement. You want to look at the doctor, either that you currently have or your panel of doctors, and see whether they are involved with Medicare Advantage plans or whether they're involved with Medicare supplements or both. Another thing is what type of health care that you need or want. So you're looking for integrated care where the company kind of manages it all for you, or do you do a part of that? Are you one of those people who has a lot of emergencies, or is that something you hardly ever use? Again, there's different copays and that kind of thing. And then what are your meds? Different meds, again, are on different formularies. So you want to look kind of what are your options. So if we take path number 1, which is the Medicare supplement, the premiums in Colorado range from about $135 a month when you first turn 65 up to, and they can be more than that, but when you get to age 80 or 85, you may be looking at something closer to $400 or $500. You always have to pay the Part B deductible, which will be $240 in 2024. This just reviews the 3 parts that Medicare or Medigap supplement, Medicare supplements or Medigap pays. So there are doctor bills and other bills for Medicare. Medicare then pays the approved portion, usually 80%, on Part B. On Part A, it's the Part A deductible, and then they pay everything else. And then your Medigap plan basically pays what's left over, which is the 20%, or in the sense, if you have the Part A deductible, then they'll pay that $162. A Medicare supplement basically is designed to fill the coverage gaps. So one of the things to know is that benefits are standardized. So a plan G is a G, is a G, is a G, doesn't really matter whether you buy it from State Farm, from United Healthcare, from Cigna, from Humana, or some less well-known company. You have the freedom to choose any doctor in the United States as long as they accept original Medicare. You never have to have a referral to see a specialist. You want to go see the ortho guy, make yourself an appointment, and you're good to go. It's guaranteed renewable, meaning you could use $1 million worth of care this year, and they cannot drop you unless you don't pay the premium. And the costs are really predictable in the sense that you don't have any out-of-pocket expenses. You just pay your Part B premium and your monthly premium, and then that's what you paid for the year. So I said there were these different kinds of plans. So there are 8 plans, A, B, D, G, K, L, M, N in the Medicare supplement world. The most comprehensive one at this point in time is the G, and it pays for everything except the Part B deductible. And by federal law, nobody could pay that if you buy a Medicare supplement after January 1 of 2020. If you buy a K or an L, you pay a percentage of the costs. And then when it reaches the maximum, then the company pays the full amount. And similarly, if you buy an M or an N, certain things they will pay and you pay other stuff. This is a very busy chart, but this is a list of all of the companies that were approved in September of 2023 that sell Medicare supplements in Colorado. If you wish to pursue that list, you can go to the Colorado Department of Insurance and Google Senior Health Insurance Counseling Program, and that list will come up and you can get more information about individual companies. When you enroll in a Medicare supplement, as I said, there is guaranteed issue regardless of any pre-existing conditions when you turn 65. I always tell people if you choose the Medicare supplement, you pretty much have to plan to be with that company the rest of your life, because most of us end up with pre-existing conditions. And once we have a pre-existing condition, another Medicare supplement, which may have a lesser premium, does not have to take us as an insured. And so usually once you have that company, you just need to stay there. If you are in a Medicare supplement and you choose to go with a Medicare Advantage plan and you decide you do not like the Medicare Advantage plan, then oftentimes it's very difficult to get back into the Medicare supplement unless you do it within the first 12 months after you are eligible for Medicare at age 65. A lot of people get very confused about the annual enrollment period, which is now, if you have a Medicare supplement, you don't do anything with it, you just leave it alone, unless you're planning to drop it and enroll in a Medicare Advantage. But you should review your Part D plan every year. We see formulary changes, we see copay changes, we see tier changes all the time. So you need to review your Part D every year. Now, enrollment. So if you do a Medicare supplement, you have to enroll in a D. And you have to have A and B to be able to do that. So D, as I said at the beginning, is also offered by private insurance companies. The drugs vary from plan to plan. They vary from year to year. Medicare does require that they cover 2 drugs in each therapeutic category. So there'll be at least coverage for two different drugs in every category. They do not cover, they cover outpatient prescription drugs, but they don't cover things like over-the-counter drugs, vitamins, and stuff like that. Now, in addition to having to cover 2 drugs in each category, Medicare also requires that for these 6 different classes, all drugs that are on the market and FDA approved have to be covered by the Part D plans. So if you're on an antidepressant, really doesn't matter which one you are on, they have to cover it. So this is just an example of the different tiers. So tier 1 is usually generics. Most of the time you either pay a very low copay or sometimes there's a 0 copay. Tier 2 is often a preferred generic, a preferred name brand. Again, there's no consistency from company to company, but you often will pay a little higher copay. The cost of the drug is a little bit higher. Tier 3, you start getting more into these non-preferred drugs, and the copay will be higher. This year, we're starting to see some percentages. So, for example, the plan I had last year on a tier 3 is charging a 35% copay of the cost of the drug. And then if you get in usually to tier 5 and 6, you're usually on these specialty drugs, often are paying as high as 50% of the cost of the drug. These are the standalone Part D plans that are selling coverage in Colorado in 2024. So when you sign up for a Part D plan, you will buy one from one of these companies if you're doing the standalone. Okay, let's say that you don't want to do Path 1, which is a Medicare supplement with a Part D, but you, excuse me, have had been in a Medicare Advantage plan, and you like Medicare Advantage, you have doctors, pretty sure you've checked with your doctor, and they will continue to see you as a Medicare Advantage person. So say you had United and your doctor took United prior to 65 and they've agreed to take United Medicare Advantage after you turn 65. So you want to continue with that doctor and that same type of coverage. So as we said, one way to look at this is it's integrated coverage, meaning that you have Part A, all of the inpatient care, Part B, the outpatient care, and most of the Medicare Advantage plans also include Part D. So Medicare Advantage covers a lot of different things in addition to Parts A and B. They can cover it, but they don't have to, but they can do things like dental care, vision, eyeglasses, hearing aids, over-the-counter health items, and other wellness programs. They can do foot care, telehealth, personal emergency systems, transportation. So there's a wide variety of things that they can offer over and above what original Medicare does. The cost savings sometimes is that you have very low to no copays. This is especially true if you are younger and don't have or use a lot of medical care. Where people get into trouble is as they get older and they have more chronic disease, such as they'll get arthritis or they'll get diabetes or they'll have a stroke and they need more care. Then it's not that the copays will go up, but they will have more of them. So they will have more out-of-pocket expense. So Medicare Advantage often works very well in terms of cost saving when you're younger, but may not be, may have some higher out-of-pocket expenses as you get older. There are limits set by the federal government for out-of-pocket spending limits. This year in the Medicare Advantage, the lowest one is $2,900. If you go in and out of network, depending on the care, the highest out-of-pocket is over $11,000. Most of the time, they do not have deductibles, and many of them have zero premium offers, so that sometimes works as well. The Medicare Advantage, as I said, they have the zero premium plans. We're seeing, in addition to the basic kind of services, we're seeing some creativity in wellness benefits. And there's a new program that at least one of the companies is offering. It's called a give back program. And like you get this give back program, which is like $200 a month or something. And it's basically like a debit card that you can use to pay for anything you might need, whether it's rent, utilities, groceries, whatever you need to pay for. There are 5 types of Medicare Advantage plans. So there's the traditional HMO, which has its own network. They negotiate all of the provider agreements with the doctors and the labs and the x-rays and the nursing homes and what have you, and you use those providers. The second type is a PPO, where they have an in-network provider system. But if you want to go out of network, say you have a particular specialist that you want to continue to see, you can use the PPO to see the network providers, all but that one, and pay a higher copay. The private fee-for-service is my least favorite. They also have a network of providers, but then in addition to that, the providers, you can see a provider who can decide on a case-by-case basis whether or not they are going to accept your insurance for coverage. That is my least favorite. We now have these special needs plans for probably the last 10 years or so. The D-SNPs specifically focus on providing additional coverages and benefits for people who are on Medicare and Medicaid. The C-SNPs focus on chronic disease management. So there might be one for, say, kidney dialysis, or there might be one for diabetic management or whatever. And then the I-SNPs are specifically for individuals who are usually in rehab nursing homes, long-term care nursing homes, or some of the companies have started to write them with assisted livings as well. And then the last one is an HMO point of service contract. And these contracts basically are written for individuals who are like snowbirds. So say you spend your summers in Colorado and your winters in Arizona or Texas, you want to sign up with the point of service contract so that when you are in Arizona, you can continue to get health care should you need it. These are the companies that are selling Medicare Advantage plans in Colorado for 2024. What I want to mention here is that some companies like ARP, Aetna, Anthem, Cigna, Humana, United, they sell Medicare supplements, they sell Medicare Advantage plans, and they sell Part D plans. So don't be confused by those companies being in all three markets, depending on what it is that you want to buy from them. There's nothing that says you have to buy your Medicare supplement and your Part D from the same company. Oftentimes, to be honest with you, they don't offer the most cost-effective Part D plan. And since you can change every year, you may not want to be wedded to the same company that offers your part or your Medicare supplement. Additionally, the Medicare Advantage plans, they always have to offer the standard benefits through original Medicare, but things like their premiums, their zero premium plans, their co-pays, their tiers on their formularies, their add-on benefits, those tend to vary from year to year. So for example, Devoted this year is not going to offer a transportation benefit. They have decided to use that money for that give back program where you can use the money for whatever you want, rent or whatever. So now we're at the decision point. Are we going to buy a Medicare supplement with a prescription drug plan, or are we going to buy a Medicare Advantage? So this is just a chart that kind of compares the two. Not really anything we haven't talked about. So doctors and hospitals in a supplement, you can choose whoever you want. The Medicare Advantage usually use the network doctors. Specialist referrals, you can go to a specialist without a referral. Medicare Advantage, some of the plans are going to require a referral. Some you can go without a referral. Med Sups do not use any type of networks, so you just go wherever you want to. Medicare Advantage, all of them use some type of a network and do provide emergency care for travel in the United States and abroad. But if you're going to be out of the service area, you may either want to choose the supplement route, or you may want to use like the PPO route in the Medicare Advantage or the point of service route. Enrollment, you can buy the Medicare supplement anytime after you turn 65 and you have your Medicare Part B. You can, on a Medicare Advantage, when you turn 65, you can sign up and then you can switch plans during open enrollment or annual enrollment every year. Costs on the Medicare supplement, you're going to pay a monthly premium at age 65, probably plus or minus $150 a month. And then that will cover your out-of-pocket expenses. On a Medicare Advantage, you probably will pay a low or zero premium. And then when you use services, there'll be co-pays, co-insurance, and deductibles. Med Subs, the prescription drug, you do have to buy a standalone prescription drug plan. Usually in a Medicare Advantage, it's part of that, and that's often known as an MAPD then. Out-of-pocket expenses, you're always, always, always going to have to pay the Part B premium. This gets taken out of your Social Security check, and that is the $174.90. Regardless of what you've got, you're going to have to pay that. In the supplement, you'll have a Part B deductible. Again, you are going to have to pay that $240 for 2024. On the Medicare Advantage side, there's a monthly premium, but usually there's no deductible for Part B. On the supplements, the premiums are going to be higher than an MA plan, but you will have more out-of-pocket on an MA plan for co-insurance for hospitals, skilled rehab if you're there more than 21 days. And Part B will have some 20% out-of-pocket for things like durable medical equipment, outpatient services, etc. You'll have to pay the Part D deductible to the standalone company, and your co-pays are going to vary. And there's no maximum out-of-pocket expense for A or B or Part D. And there is a maximum out-of-pocket, and that varies annually for Medicare Advantage. So that kind of concludes, hopefully, the information to help you get a better understanding of what's happening as you want to try to compare those. The Society offers a counseling toolkit, so you can get services around counseling for Part A, B, C, or D in English or Spanish. You can get counseling on the difference of Medicare Advantage or Medicare supplements. We are not insurance brokers, so we cannot help you enroll in any of those. In a Medicare supplement, you're always going to have to go through a broker. A Medicare Advantage, you can enroll online if you do not want a broker to come to your house. Prescription drug plans, you need to go through the Medicare Plan Finder and figure out which plan best meets your needs. If you need help and support, we can do that in English or Spanish, and we can walk you through the process of enrolling online for a Part D plan if you do not want to work with an agency. We can refer you to Medicare Supplement, Medicare Advantage, or prescription drug insurance agents that we work with if you need a referral. I often tell people to check with their insurance broker for their homeowner's insurance or their car insurance, because often you can just use that insurance. We are partnering again with the University of Colorado School of Pharmacy. So if you want some type of a clinical review of your medications, that probably can be arranged. We have a limited number of appointment slots. And those students are supervised by a faculty member with all of their work. We do put up all of our Medicare work on our YouTube channel, so you can go there, and you can also review more information at our website. Just a little bit about CGS. So we do try to focus on the social determinants of health. We do have a vision, hearing, and dental program where we provide grants. Vision and hearing services are available in the Metro Denver area. Dental services are in Metro Denver, plus everything west of I-25, except Pueblo and Colorado Springs. We also have a mental health counseling program for people who live in the city and county of Denver. And we also have some grants available for people who need low vision aids. The Telephone Buddy program, you can either be a telephone buddy or call, or have someone call you, and they will check in once or twice a week just to check on your well-being and whether or not you have any other needs. Our advanced care planning services are pretty comprehensive in terms of counseling people through advanced directives like powers of attorney and those kinds of things. We're not attorneys, so if you do something other than the pre-printed forms, you will need to go to a private attorney. This just provides you basic information. We do a holiday basket program for people in Metro Denver. We also have our housing and home care locator online at our website, should you need any or have any questions about finding housing or home care in Colorado. We also do a lot of education and advocacy with our Salute to Seniors, our Senior Resource Guidebook, have some family housing supports, housing advocacy, Stay Well News, and our YouTube channel. And that concludes our presentation for today.